It's now about 24 hours after his collagenase injection, and you can see that he's got some bruising here, which is very typical. Did you have any pain in the arm, in the elbow or under the arm? No. Nothing there. Any swelling on the back of the head? Not much. No. But this is very typical, the bruising here. As he just related, he's already noticed that there's been some improvement in the extension at the MP joint. PIP joint hasn't changed very much, and that's not uncommon that the patients come back for their manipulation, and they have in some cases already done the manipulation on their own just by using their hand. So what we're going to do is put in a local block so that I can manipulate his MP joint, the metacarpal phalangeal joint, hopefully into a bit more extension still. Sometimes when we do the manipulation, there is a little bit of a skin tear sometimes where the skin has become somewhat shortened because of the contracture. When you extend it, sometimes there's a bit of a split in the skin, so we're always prepared for that. A little pin stick. And when we manipulate this, sometimes you need to use a fair amount of force, so it's nice to have a metacarpal block in place so that it's not uncomfortable. According to the collagenase protocol, we're not allowed to give any local anesthetic while we're giving the material itself. Yeah. And I think the reason for that is that we want the patient's feedback in case we get too close to a nerve or a tendon, that the patient will give you a little bit of feedback so that you don't inadvertently inject into a otherwise sensitive structure. So that's plenty, and that should make that whole finger pretty numb pretty quickly. I don't know if you feel any change there now.
No.
So he has adequate anesthetic now, and what I do is usually put a little betadine paint in this area, and the reason for that is that, as I said, sometimes when we manipulate this and we do it fairly vigorously, sometimes you get that skin split. So I want to make sure that if there is a small skin split, that the skin overlying it is sterilized. So I'll just put on a pair of gloves for the same reason.
Yeah, that's really numb now.
Good. That's what we want. Now the other thing we do when we manipulate this, we bend the wrist a little bit, and the reason for that is we like to take the tension off of the flexor tendons so they're not acting as a deforming force, and then we just bend the wrist down, and then we extend the joint like that. Now I can feel under my fingers. I can feel. Did you feel any of that crunching?
I didn't feel any crunching. No.
No, I can actually feel the tissue letting go. Yeah. So that's what I mean about it's not a subtle process. We give it a really good forceful manipulation, and I think that's about as far as we're going to go. But now straighten your hand all the way out. Okay. Now that's pretty amazing, isn't it?
Yes, it is.
Look at it from that angle compared to where he was yesterday. We'll be able to look at yesterday's. Isn't that amazing?
It definitely is.
And then just rotate your hand like this. And so here's the tiniest little skin split right there, and we'll put a little dressing over that until he gets over to the hand therapist. But put your hand flat now. Right down flat. Now you couldn't do that, could you?
No.
Put it right down like that.
I was amazed before you even bent it back there.
Yeah.
That what I could do with it.
And now it's quite even better still.
Yes.
Even better still.
Yes.
I think yesterday when we measured him yesterday before we did the manipulation, I think he was about 55 or 60 degrees, and now he has about a 5-degree residual flexion here, and at the PIP joint about 10 degrees. So we may not even need to. We'll see. But I thought we'd have to do another injection out here in this cord to get the PIP joint straightened out. But it's improved fairly dramatically just with the single injection. So I'm very happy with that. And if you feel in there now, that cord that we could palpate so easily yesterday is now gone. I'm just going to put a simple simple gauze pad on this. And from this point, you'll head right over to see Colleen, and Colleen will make you a nice extension splint to wear. And that wasn't too uncomfortable for you, was
No,
it?
it wasn't.
Yeah, good. So, we'll head you right over to the hand therapist and get your splint made, and then I'll plan to see you back in 2 weeks.
2 weeks.
And see how you're doing.
And how long do I keep the splint on? For the
Colleen
2
will explain all of that to you, but primarily we use it at night just to maintain the extension at night, and then during the daytime we like to get you started
Use
on
it.
motion early. Yeah. And just at night we put you in an extension splint to make sure you maintain as much extension as we can, but we don't want to sacrifice extension for a good functional flexion. So during the daytime we want you to be using it in flexion and maintaining your normal flexion. All right, very good. You did great.
Thank you, doctor. It's
Thank you,
terrific.
Doctor.
Yeah.